old people. Why? Because 90% people, they put their head into the shower, hot water. So vasodilatation, aneurysm, weak parts of they will rupture and they will be stopped. So it's said that always first make your feet wet, legs, rest of the body, so there is a vasodilatation and whole blood is pooled in the limbs and in the body. Little blood is left to rush and to go to the brain. It's the by the way. So if you start exercise or put hot water on your limbs, there will be vasodilatation and then good diastolic flow. Triphasic waveform is lost. The patient has come after walking 200 meters and you immediately lie down, I am having a very busy clinic, going to start your scanning and put your pro, you will see there is good diastolic flow, there is spectral broadening, having that must be some proximal stenosis, wrong diagnosis. Patient must take rest for some minutes. Patient has come huffing and puffing from the street in a rickshaw and rushing to you, doctor, my time in oh yes, I am very busy time, I can't wait for you. Lie on the bed and put your no. You have to give time to the patient, otherwise you will be getting erroneous information. In ideal world, we are talking all that in ideal world. When the wall is smooth, no calcium plaques, but does patient come with a smooth wall? No. When patient come for peripheral vascular disease, they are old people having some problem. So if you are living in an ideal world, we won't get those classical cases. Normal people won't come to the doctor for peripheral vascular studies. So if in an ideal world you get this crisp, very good picture, right? Smooth wall. But what happens if that wall is having plaques and irregular wall? Can't you have that smooth pattern of the flow? You can't have, you see calcium, wall is irregular, and then you get this turbulent flow. You can't get I showed you a river with very smooth flow, having parabolic flow, laminar flow, but in real world, you see this splashing of water. In the same manner, you can hear that splashing when you turn on your Doppler noise. That's the non-laminar flow. You see here a lot of turbulence because it's striking against the hard rocks and in the same manner the calcified plaques. So what will you get? You get red and blue because there are plaques. So in the same manner there is a carotid bulb. This swirling movement, the room of the dome, that swirling movement won't give you the very good, nice red color or the only blue color and very nice crisp spectrum. You can't get a crisp spectrum. You should know where you are. Which part of the vessel are you negotiating? That's important. If you are having that turbulent flow, you can't get that crisp. You will get to and fro movement because you are having blood is striking against the rocks. So it's not giving you one color. This non-laminar turbulent flow is there. So if this tortuous like a snake, running like a snake, some rivers are, the old river, they are running like a snake. So where there is a turn, you see here the turn of the vessel, you yellow the highest velocity. You take a good, swift turn in your car, what will happen? Your car is pulled to the outer side because highest velocity on the outer side. You see that color will be seen here. So if you are tortuous vessel, do expect that different bizarre appearance of colors. Sometime in this manner is a tortuous vessel. So on the outer side, highest velocity, inner side, lowest velocity, so colors will be changed. In the same manner, spectrum will be changed. So in aorta, you have thin waveform line, but if it's this squeezed vessel is squeezed somewhere, the stenosis, the spectral broadening that you see here, after that squeezing, if you just squeeze a pipe, then the splash of water will go everywhere. It won't go straight. So in the same manner, blood is passing through a squeezed vessel, so there will be a turbulent flow and after the post-stenotic turbulence, that's called post-stenotic turbulence. So this is a nice normal, this is a post-stenotic turbulence, and and that turbulence is seen like, spectral broadening, because so many velocities are seen, because there is a lot of stenosis, and it's causing the calcium plaques, causing the vessels, the RBCs to splashing, as the water splashing in a river in the same manner is splashing against the rocks or the calcium plaques.